Are you ready for the health check with Dr. B and Zuzu Mavuma, sponsored by First Capital Bank?
Health Check is proudly brought to you by First Capital Bank. Belief comes first.
Good morning, Dr. B. How are you this morning?
Good morning, Zumavuma. How are you?
I'm good. Thank you for putting the whole name there. I'm so good this morning. I'm also excited to talk about what we're talking about today. It's you laughing for me.
I tell you, I can tell that people are listening to our show, Zoo, because this is we've had an overwhelming response, and that just tells us that those naughty guys and girls out there who do listen to some of the more equally interesting subjects never ask us, the equally interesting questions.
Exactly.
Questions, and we're not going to be able to finish them. Last count, 106 questions.
Oh, wow, Dr. B, that's a lot.
I'm telling you, and some of the strangest ones. But anyway, let's just talk about what the subject of today's talk is: erectile dysfunction or impotence. So, impotence, basically, let's get basic anatomy together. So, when a man has an erection, it's simply a function of blood flow.
Yeah.
So, it's very important for men out there to understand that erection problems are very common, particularly in men over the age of 40. And it's usually nothing to worry about, but you should see your GP or your primary care doctor if it keeps happening and you have some sort of underlying health condition. Now, it's really important for men to understand that the commonest cause of erection problems that we see in all our clinics is usually caused by stress or tiredness, anxiety, sometimes drinking too much alcohol. And it's usually nothing to worry about, except you need to tackle those issues. I mean, in this day and age, in the 21st century, people overwork, they don't sleep enough, they escape by taking alcohol or tobacco, even worse. And some people are taking pills that actually can cause it. So look at what's going on around you rather than say, there's something wrong, I need to take a pill. It may be that the pill that you're taking for blood pressure or cholesterol may be causing it. Maybe that you've got issues to do with your partner, or you've got, financial stress. Because remember, Zoo, I can't say remember, Zoo, because you're not a man.
How do you know, Dr. V?
Yeah, that's true.
Yeah.
Let's be gender neutral here. Yeah. So for a man to get an erection, they need to be chill. They need to be relaxed. The biggest issue that we have with men who fail the first time is what we call in medicine apprehension anxiety. To say, Happy, last time I didn't manage to perform. My erection wasn't long enough, wasn't hard enough. And so that anxiety builds up to actually make sure that the next time you don't actually get one, because you keep thinking, I need to get an erection. And so if you can't do that. With men, you have to be completely chilled. If you're thinking about it, it's like trying to get yourself to sleep and say, I must fall asleep.
Yes.
The more you think about it, the less your chances are you're going to sleep. And it's the same with an erection. You really need to be relaxed with your partner. You need to be fairly focused in terms of not having too much alcohol and be not too tired. So these are important issues that go on. But the purpose of really today's discussion, Zoo, is to highlight those issues that actually often are a signal to us of heart disease. One of the first warning signs of heart disease, believe it or not, Zoo, is actually men coming to say, I can't perform. And I call it the door on the handle consultations, Zoo, because men don't want to talk about these things. And what they do is, after the end of a consultation with the doctor, just as they're pulling the door handle to say goodbye, they'll say, oh, by the way, doctor, I'm not having, much sex. I'm not having a good erection, because
at the 11th hour.
At the 11th hour. And there are some issues. So here are some percentages that may frighten men out there, because we've had some issues about how common is it. Well, 40%, it starts at the age of 40 generally, and 40% of men have issues with erectile dysfunction. And as you go up by decade, 50-year-old, 50%, 60-year-old, 60%. So it actually goes with age. And people try and, take all sorts of supplements, which we'll talk about. But first of all, make sure that you don't have any underlying conditions. And the things that clog up arteries in your heart and in your brain and in your kidneys are the same things that clog up arteries in your pelvic organs. And these blood vessels, Zoo, are really tiny. So the moment you have too much cholesterol in your system, you have sugar in your system, you have alcohol, you've got tobacco, all these things cause issues with circulation to the pelvis, and as a result, you get erectile dysfunction. There are some drugs that can cause it, certain blood pressure drugs, certain cholesterol drugs, certain antidepressants. So make sure you're not taking something that may be causing these issues. Now, the biggest question people have asked is, should I be taking something to improve my erection? And the one that's sold in this part of the world is called sildenafil, or Viagra as it used to be called, but there are lots of different variations. And in most parts of the world, you don't need a prescription anymore, but in our country, we still need a prescription. So you'll need to see a doctor who will actually understand if you need this thing. And what does the Viagra do? All Viagra does do, because people think that it's an aphrodisiac. It's not. All it does is it improves blood flow temporarily. Actually, it was developed as a blood pressure tablet. And what they found in animal studies is that in rabbits, these rabbits had a drop in blood pressure but raging erections.
My goodness.
So Pfizer, the clever company, said, we're not going to use this for blood pressure. We're going to use it for something else. And lo and behold, it's been a multi-trillion-dollar industry. So they're not on the market. Whether you need it or not depends on what's wrong with you. But the things you can do to help your erectile dysfunction obviously are lose weight if you're overweight, stop smoking, eat a healthy diet, the same title things that we churn out every week: exercise daily, reduce your stress and anxiety, and get some sleep. Somebody's asked here, so I'll answer some of the questions here. I'm a regular cyclist. Does cycling affect my erection? It can if you cycle for more than 3 hours a week, because you're hitting the pelvic area when you're sitting on that small little tiny seat on those. And so be careful if you're cycling for long distances, and if you're having issues, go and see your doctor about this. And somebody says, how much can I drink? How much can I drink? And the answer is not more than 14 alcohol a week. Men out there,
Yeah.
14, you can't have your cake and eat it too. You can't have your erection and your alcohol.
That's a good one, Dr. B. I'm stealing that one. Yes.
And one of the questions we have been asked by a lot of women out there is, can I use Viagra as well if I have issues with sexual dysfunction? Sadly, as yet, it's a man's world, and unfortunately, if it were not a man's world and a woman's world, we'd have a medicine exactly like Viagra for women, but it's not yet on the market. Viagra doesn't work for women. It doesn't improve their sexual function or desire. But beyond the very small threshold, there's going to be some fantastic stuff that women can use to improve their sexual function. But I wanted to tackle also the issue of emotional psychological problems, because we've had lots of questions coming in from 20 and 30-year-olds, and the majority of 20 and 30-year-olds who, unless they have a physical issue, it's emotional.
Yes.
There's something going on with their partner, or they're getting joy somewhere else out of their marriage, or they're abusing drugs, or they're taking tobacco, so look at what's going on around you if you're in your 20s and you're having a problem, and think about this word called apprehension anxiety. So it's really important to understand all these issues, though.
Definitely. And Dr. B, I know that some people may have issues with, like you're saying, erectile dysfunction with the foods that they eat, or is that just another myth?
No, absolutely, Zoo. I mean, let's tackle it the opposite way. People have asked me what aphrodisiacs can improve my sexual life, and the commonest ones are actually things like dark chocolate. Things that so if you have a dark chocolate, a little bit of cocoa or cacao. There are certain foods like pomegranate. There are lots of things that actually have been shown to improve sexual function, and I think the most important thing, Zoo, is to enjoy being with your partner and being relaxed. If you do all those things, really you won't have an unsatisfactory sex life. If you try and manage your anxiety and embarrassment at the first time you don't succeed, and tackle your relationship problems, these are really issues that, for me as a doctor for more than 30 years, are at the core of the issue, rather than, can I take a pill? Because people just want pills, people want injections and lotions and potions. And I believe me, Zoo, a lot of the stuff is actually snake oil stuff. It doesn't really work. There's some huge tablets on the market that are multicolored, and men swear by them. They are sort of cheap versions of Viagra, and they don't actually work. They have what's called a placebo effect, because you think you're taking something, it actually has a positive effect on your mental state. So these are really important issues, and psychological issues very important, and then of course medical issues in terms of, like you said, disease, heart disease, arteries, cholesterol, obesity. those sort of things, tobacco use. So address those issues because they become an issue. And, erectile dysfunction may be the core of sometimes a marital breakdown. That, your partner thinks that you're cheating or you're going elsewhere and you're always tired. And it works on the man and it works on his erection and he just gets, the man gets, excuse the pun, he gets his nappy in a knot.
The whole knot, Dr. B. And so, also other things like you're saying, like financial stresses, all these other things. I see that some people do take supplements and medicines. Is this like a treatable and curable thing?
Very much a treatable thing, Zoo, but it requires patience. It's not flu and it's not a cough or a cold. It takes time. If there's an emotional, psychological, financial,
yes.
These things can't be raised overnight. So you need to work with your partner on these things. Some supplements have been shown to improve erection. There's a particular supplement called L-arginine. Arginine is something that actually opens up blood circulation, but it's something that needs to be taken last. First, exercise, lose weight, stop smoking, don't drink too much, be well with your partner, get some sleep. All the things that people don't want to hear because the questions I've got here are all about medicines and supplements and all sorts of stuff. And I want our men out there to say, you know what, look at yourself in the mirror first and say, what may be causing some of this stuff rather than what can I take for it?
You see what I'm saying? As I play Michael Jackson, Man in the Mirror, Dr. B. So one final thing, Dr. B, is what kind of advice would you give young men, especially with their health? Like you always say, like eat healthy, do all those stuff, and like therapy, because I saw on Twitter, like a lady had said during Breast Cancer Awareness Month, a lot of women came and checked themselves and did a lot of things. But during this month, men are not taking themselves or their brothers or their friends to the hospital. So you as a man, what kind of advice or what kind of like push, encouragement would you give these young men?
The first thing I'd say to all young men is stop taking addictive compounds. Unfortunately, we're an addicted nation, in terms of whether it's television, whether it's fast food, whether it's, junk food, whether it's those Cokes and Fantas out there. Honestly, we're poisoning ourselves.
Yeah.
So, cut the junk from your diet. Have a healthy relationship. Exercise. In terms of testing, we've talked about this, make sure you examine your testicles to make sure there are no lumps and bumps. Make sure you check your blood pressure. If you're over the age of 40, get your prostate checked to make sure you don't have any prostate issues. And if you're having erection problems at a very young age, it may be that you have a physical issue. It may be that there's a blood circulation issue that you're born with. So go and see a doctor. If you're in your 20s and you're having problems getting an erection, particularly an early morning erection, men, the testosterone, the male hormone is highest first thing in the morning, which is why, even without any sexual stimulation, men have erections. If you don't get those in the early morning, there's a sign that something's wrong. You may actually have a circulatory or a nerve issue. So go and see your doctor, who may refer you to a urologist, who is somebody who deals with the pelvic organs.
Well, Dr. B, as I say every weekend, I'm so excited to talk to you. What are we covering next week?
We're covering something that actually I have been smacked on my bottom to say, why haven't you been commemorating World Diabetes Day? So we are going to be missing it by next week, but because next week is December. But Diabetes a month was actually November, together with Men's Health. So we're going to be doing what is diabetes and why it's an issue for Botswana and our country, and what is it that's such a big deal about diabetes next week.
Excellent, Dr. B. Well, have a great Sunday.
You too.
Bye. And that's Dr. B and myself on The Health Check with First Capital Bank. Come on.
Health Check was proudly brought to you by First Capital Bank. Belief comes first.